2015 cholesterol counts poll is out, and spoiler alert, the title is Cholesterol Knowledge Still Low in the US. Something tells me you're probably not terribly shocked at that, but maybe there's something we can do about it. I am with Mended Heart's Executive Director, Michele Packard-Milam, and thank you very much for coming by. This is a poll that we've seen before. It doesn't seem all that exciting in terms of, man, this really is depressing.
It is depressing.
But give me the numbers first, then we can talk about what to do about it.
Well, what we're discovering is that in the Cholesterol Counts program, which your listeners can take the poll at cholesterolcounts.com, people have lost track of the idea that they need to know their cholesterol numbers, in particular their LDL numbers. And so we're trying to figure out just how much work we have to do to get people to understand the importance of these numbers and to ask their doctors. So we have about 12,000 people who've taken the poll so far, and the vast majority don't know their LDL number. And interestingly, of the people who took the poll, about 65% of the men expressed concern that there might be some personal impact to them, but only 35% of the women. And that's a pretty interesting thing to discover. So we're thinking maybe it's because women are used to taking care of other people's health and not their own, but we feel like they need to know, they need to understand that heart disease kills as many women by percentage as it does men. It is a woman's disease as well as it is a man's disease, and they need to know their numbers as much as their husbands and their sons do.
Now, in terms of what can we do about it, I mean, obviously, cardiologists in particular, and GPs we hope, are getting this information to the patient, or are they?
Well, we think cholesterol is getting checked by the conscientious healthcare providers, but the doctor is saying either your cholesterol is too high or your cholesterol is okay, but the patient doesn't know to ask, what is my LDL-C number, doctor? Or healthcare provider.
They need information from the doctor that literally says, your number is.
Your number is.
Blank.
And your ideal number, if you have no other cofactors, would be 100. If you have a number of other related factors, you've ever had a heart attack, you have diabetes, your number should be 70 or lower. But patients don't know that, and the poll is bearing that out. Almost no one knows that fact, and very few people know their own numbers. And we think they need to know, if they're only going to know one number, that's the number to know.
Yeah, that's probably correct. In terms of Mended Hearts, tell us about you, because for anybody who doesn't know, it's about time they find out about the Mended Hearts people.
We would love for people to know about Mended Hearts. We've been around for 63 years. We are the largest peer-to-peer cardiovascular support network in the world. We have about 20,000 members. We visit about 215,000 patients every year at the bedside, in the rehab center, in the cath labs. And we are heart patients and caregivers visiting heart patients.
And I guess the last thing is, was there any good news? I mean, whether it's from this poll or anything else, this is pretty depressing. Is there any good news that you can tell me?
I think there's good news in that we got 12,000 people to take the poll already, and we're hoping for many more.
That's actually quite impressive.
It is good. The poll is going to stay live for a whole year. We started in Heart Month, and we're going to read it again in Heart Month, and we're actually hoping to see if we can move the needle, if we can raise awareness and get more people to learn their numbers. And that's the key. If we can get even a fraction of those 12,000 people, let's just say half, to say, I need to know my number, and you, family member, need to know your number, whether it's your 20-year-old son or your 65-year-old dad, whoever it might be, they need to know their number. And if enough people get that, we're good.
Well, if you could come back, and when you get more information on this, please. Our doors are always open for you.
Thank you. I would love to come back.
For the ACC 15 meeting, which is in beautiful San Diego, California, and for CardioSource World News, I'm Executive Editor Rick McGuire.